Welcome back to Good Day. We want to talk about something that's a little serious about, having a child is one of the most exciting things for a family, but there is something that happens sometimes to moms with baby blues and postpartum depression. It's a very real thing, and unfortunately there's a stigma attached to it. We've got Dr. Aisha Taylor, an Ob-Gyn with Kaiser, to kind of talk about what exactly the baby blues are, postpartum depression, and how this affects the entire family. It's not just the mom who's affected, right?
Right, and so thank you so much for having me to talk about this very important topic. And I really want to raise awareness around baby blues and postpartum depression to remove the stigma, because there's nothing that a new mom should feel ashamed about if she's having any of these symptoms. So baby blues usually starts about after the first week of life. It can affect any new mom, and it usually comes on from being fatigued, changes in hormones, or just the demands of caring for a new baby. But baby blues is short. It usually is self-limiting, which means it resolves by itself, and it really doesn't require any additional support from outside resources other than just getting adequate rest, getting support from friends and family.
Okay, so let's tie in the friends and family for these specific points, because now we're talking about postpartum depression.
Right.
That's when it gets a little bit more elongated, and the family should really be paying attention to these signs too.
Right, so postpartum depression usually starts around after 2 to 3 weeks of being in the postpartum period, and the symptoms are a lot more severe. So moms may experience extreme anxiety, sadness, irritability, difficulty sleeping, overly exhausted, decreased appetite, decreased attention to being able to focus, and just no interest in anything that they typically had interest in.
The things that she loved to do before, she has no interest in anymore. What about feeling overwhelmed? A lot of people confuse that because, especially if this is your first child, you are overwhelmed because this is a very different and new thing for you, but that overwhelmed, hopeless feeling is very different.
Right, so feeling overwhelmed but not being able to really push past that, not being able to really emerge from that, feeling sad and not really understanding why, and just not being able to find joy in anything. And so if you're having these symptoms and you're crying and you're extremely irritable and you feel like you're not doing a good job, it's really important to reach out to your perinatal team, reach out to your partner, reach out to friends or family. If you have a friend who's also a new mom, just talking to someone is really important, that you talk about it and that you don't feel ashamed about the symptoms and the feelings that you're having, because they're very, very common. And you'd be surprised how many people experience the same exact feelings that you have.
Absolutely. So what should family members do if they see some of these symptoms of postpartum depression? How should they either address it or approach the new mom?
So talk about it, right? You want to make sure that you're bringing it to the mom's awareness. Hey, I see you're feeling like this, and how can I support you? Sometimes just being there, showing up to clean out the closet, or showing up with her favorite tea, holding the baby so that she can shower, take a nap, or maybe get a bite to eat, or maybe even go to an appointment. I'm going for a walk, sitting there and listening, watching a movie, cleaning the kitchen, something that just takes the load off of her. But really just bringing it to her attention so that she's aware and that she feels free to talk about the symptoms that she's having.
And definitely not feel ashamed.
Absolutely not.
Nothing unusual or strange about it.
Right, very common, very easily treated. If it's made aware to us, we have an entire team to support new moms that are having symptoms like this. There's really important is self-care, making sure she's getting out of the house, making sure she's getting adequate rest and food, coming to the office so that we can provide our resources to her. We have tremendous support classes, counseling, and if needed, medication.
All right, and we've got those resources on our website, gooddaysacramento.com, under show info and today's dates. You can get those exact resources from Kaiser or any health agency that you use, and definitely want to reach out and make sure that people are aware so that they can help. Guys, back over to you.